You should never use 2 pillows or more when you're going to bed. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. The reason why you should never sleep with more than 2 pillows is really simple. If you look at the spine, when you're laying down, you should have this normal cervical curve. So that's the normal curve that you would have in your spine that supports your head, your spine, the joints, the nerves that are coming out. This is the good anatomical position that you want your body to be in, so that way you're not breaking down the tissues, the neurological components to it, so the spinal cord that runs inside. And this is what gives a lot of people tension. So when you go to lay down at night and you're sleeping, you want to be able to support this. And this is why they've invented a lot of pillows like the Swedish pillows, which have those curves in it. Now, the only problem with those is really when you go to bed, you can position the pillow in the right area so you're getting that curve. But once you start sleeping and you start moving around, you generally end up on the top part of it. So the back of your head will now get supported on it. And what that does is it does this to your neck. So effectively what you're doing is you've changed now the position of your spine. You no longer have that cervical curve. And when the curve is gone, you've lost the integrity. You're putting more pressure on the discs, on the joints, on the nerves, on the spinal cord. You're pulling, you're creating a tensile type of stress that can lead to tighter muscles, headaches, dizziness. It can lead to a lot of other issues because neurologically you're changing the way your brain is now communicating with your body. And you're creating a stress response. So just think of somebody running from a bear all the time. They're gonna have high blood pressure. They're gonna have problems sleeping. They're gonna be running practically on adrenaline. That's what's happening constantly inside your body. So if you are sleeping with more than 2 pillows, so 1 pillow would be highly recommended, and what happens is then your spine will go into a natural position and this would support it. So this is normal, this is good. But then you take somebody who is sleeping on their back and then you start giving it other pillows. And so we go to 2 pillows. Well, now instead of being able to do this, what does your body do? It starts to do this. And the moment you do that, you screwed up your spine. If you're a back sleeper, then I hope that makes way more sense. When you're laying down, stick to 1 pillow and make sure that it's fairly thin. It doesn't have to be thick. The problem always comes when you're putting too many pillows. Now, the reason why a lot of people like putting more pillows is because then we know that there's other problems in the spine. It's not just the neck. A lot of times it's between the shoulder blades. They're too rounded this way, and so when they try to lay back, they actually physically can't come back, and that creates a lot more tension. So if you're having these type of issues, you're noticing you can't sleep, and then you're noticing a lot of the other issues that I talked about, from having a higher stress response. The muscles are tight, you can't sleep, you got insomnia, chronic tiredness, dizziness, you're having issues with concentration, foggy brain, the headaches, migraines, vertigo, those type of issues, or the tight muscles in between the shoulder blades, even higher blood pressure, those type of issues. Again, you're running from a bear. And not only does it affect up here, you got to think your gut starts to shut down. It starts shutting down other organs, because if your body's too busy in the fight or flight response, the last thing it wants to do is focus on digesting food. So when I look at the spine and I see somebody coming in like this, well, it makes sense why they're going to have so many issues. As a chiropractor, we're not only going to make sure their alignment is good this way, all the bones are nice and balanced, but when we look at a spine this way, our goal here would be to restore the proper alignment in the curves. This is called corrective chiropractic care. And while we restore the curves, now you can lay back on your back. You're not having the hump anymore. You're able to fall back onto 1 pillow comfortably and able to get a good night's sleep. If you have any questions about this video or any of my other videos, please leave a comment down below. And until next time, have a great day.